welcome back to another video. My name's Natalia and I'm an occupational therapy student, and for the past 3 months I've been at the lymphedema clinic. I've learned a lot at the lymphedema clinic and I'm by no means an expert. I'm not lymphedema certified. However, I feel that this type of video could really benefit some people who are trying to manage their lymphedema at home. So this is going to be a follow along step-by-step instruction video, and we're going to be focusing on self manual lymphatic drainage of bilateral upper extremities and bilateral lymph nodes are affected. So this will really help you differentiate. So I have a video on the left upper extremity affected and an affected right upper extremity and the sequencing that goes along with that. This one is going to be focused on if both upper extremities are affected. So you can kind of follow along, use this as a guide, and definitely before you do anything, reach out to your lymphedema therapist and talk to them about what they think would benefit you best. This is just what I've learned at the clinic that I'm at, and I think it could really benefit some people. So with that, we'll get started. I want to go through a couple important tips first before we start that will help you make this whole process more effective and smoother. So the first tip is that you really, for the manual lymphatic drainage massage, you really want skin-to-skin contact. So for the purposes of this video, I have a shirt on. However, at home, it'd be best if you didn't have a shirt or bra on, as this would really obviously enhance the skin-to-skin contact that you have. And so with that being said, you really want your hand to be on your skin, and you want the whole entirety of your hand. So I don't want to use just my fingertips because I'm not getting the full amount, the full effective amount of my hand and pushing of fluid there. So when I'm using my full hand, I'm keeping my fingers closed and I'm placing my hand on my skin, and I'm moving the tissue of my skin with my hand. I am not sliding across my skin. That's not really going to do what we want it to do. So it's best if you are using your hand to move the tissue along with your hand. And I'm using a light to firm pressure here. I'm not going deep. I'm not pushing too hard because the lymphatics live right under the skin. So that actually could block or obstruct the flow of fluid, which is what we don't want. So after we're using our whole hand, we have skin-to-skin contact. Another good tip is that you want to be laying down in a bed or in a recliner. For this video, I'm sitting up just to demonstrate what I'm doing. But at home, you'd really want to be laying down so that your lymph nodes in your hip area and your groin area are more at an open angle. And that way everything can flow freely as you're pushing things along. Another helpful tip is regarding the direction of where you're pushing fluid. So the reason that we differentiate between right upper extremity, affected left upper extremity, bilateral upper extremities is because it makes a difference of where we're going to push the fluid. Our goal is to push the fluid to the closest, healthiest lymph nodes. We have lymph node hotspots, as I like to call them, in our head and neck, our armpits, our abdomen region, and our groin, right where your underwear line sits. So these are the hot spots. So if these are affected, the closest, healthiest lymph nodes that we want to push fluid to is down to our groin area. And that'll be on both sides. We're going to push to our groin area. And that will help the lymphatic system move the lymph fluid throughout your body. And then eventually that lymph fluid drains, but it's always going to be replenishing. So we really want to get toxic fluid that's been sitting or stagnant for a while out of those extremities, out of this chest area or the parts that swell, and into the system so that we can push it through and have new lymph fluid flow through. So with that being said, it's important that we look at the direction of where we're pushing fluid. So when you're doing the massage, you're going to be doing circular motions. We can get started, and I can give an example here. So if we're starting at the neck, which is where we start for the massage, we can use our right hand and place our hand on our neck area, kind of close to our collarbone, and we're going to use your full hand here like we talked about earlier, and you're going to push the fluid inwards. So we're going to do about 10 of these. And it doesn't really matter as much about the amount or repetition of circles. Really, you want to shoot between 5 and 10. If you do a little more, a little less, that's okay. But it really matters about what direction I'm going, because that's the direction that the fluid is being pushed. So I want to make sure that I'm going inwards for this. And I didn't count really, but that's okay. So next we would do the other side. You can use your left hand now and go inwards towards the heart. That's the key here. And again, gonna do about 10 of them. Okay, so the next part is to do our deep abdominal breathing. This breathing really helps to wake up and stimulate these lymph nodes in your abdomen, which I said is a hot spot in your body of lymph nodes. So we really want to stimulate this because this will just help with the flow of fluid. And the way to do this is to do our deep breathing. And our deep breathing is going to be consistent of a deep inhale through your nose. And as you inhale through your nose, your belly is going to expand with air. As you blow out, blowing out the birthday candles, we're blowing out through our mouth like this. And our belly is going to collapse or fall back to where it was before. So with the inhale through your nose, you're going to let your belly expand. And with the exhale, you're going to let your belly collapse. An important thing that can help you here is by placing both of your hands on your belly. It can really help that mind-body connection to know when your belly is going out and when it has to come back in. Also, a little slight bit of pressure as you're doing the breathing can help to stimulate the lymph nodes as well, so that's helpful. So we can start with our deep breathing, and we'll do about 10 deep breaths. So after you do about 10 deep breaths, our next step is to open up our groin lymph nodes. And I'll sit up so you can see. So the groin lymph nodes are going to be right about here where your underwear line sits. Or if you think about when you sit, you can feel this crease here in between your thigh and your hip. That's where it's going to be. So you're going to use these upward motions and use a firm to light pressure just like this to wake up these lymph nodes down in your right groin. So after we've done this and opened up this right hip, we're going to focus on pushing the fluid down from this right armpit down to the right hip. So this can be done through you can use both hands for this basically. So I can use my left hand here and I can push the fluid downwards in downward circles from my left armpit all the way down to my groin. Or if this is better, I can use my right arm and go down to my right groin. But I notice how I'm not sliding down, I'm just using these motions to move the tissue, and I'm going down. Again, this is the only thing really that's important here is that we're using these circular motions, and they're going into a downward direction, down towards your groin here. And you're gonna do this about 5 times. So I think that was close to 5. I can do one more in case I feel like I didn't get it. So after we go from your armpit down to your groin, we're gonna start on the right arm. So basically, the first part, I can use my hand to do my shoulder here and do some inward circles at the shoulder. And I can do about 10 of these. And then we're gonna start the arm. So you can think about the upper arm in sections. So the first section is going to be this strip, and you can do another section of the back strip. If you have smaller hands or you have a bigger arm and you feel like you're not getting enough coverage, you can do 3 strips. Just make sure you're getting full coverage of this upper arm. So I'm gonna use my left hand here. I have full coverage with my hand and full contact. And I'm using my entire hand to do these upward circles. And each strip you're gonna do about 5 times. So that was 2, here's 3, 4, and 5. Now I'm gonna do this back side, and I'm kind of going underneath my arm as well, just to get that full coverage. 1, 2, 3, 4, and 5. Okay, so we've done this upper arm. We're gonna now do your wrist to your elbow. You're gonna do both sides. So this will be 5 strips and this will be 5 strips. So we're gonna go up the arm 5 times. That's 1. And I'm doing my upward circles, that's 2. Here's 3. 4. And this one is the 5th. We're going to flip our arm and do the same thing. 1, 2, 3, 4, and 5. So now that we've done the rest of the elbow, we're gonna go do the same thing that we did before, going from the elbow to the shoulder. So we're gonna do our half circles up the front of our arm, and we're gonna do about 5 strips of these. So this is 2, 3, 4, and 5. And then we're gonna do the back, 1. Then we're gonna do the back, 1, 2, 3, 4, and 5. So now that we've done our arm, we can do our circles at our shoulder. And we're gonna do about 10 of these, going inwards again. Okay. And so now that we've done our shoulder, we're gonna go back down to our groin and do about 10 of, or 5 of these, 5. 2, 3, 4, 5. Okay, so we've done our right side. Now we're moving on to the left. So we're gonna do our same thing we did before and open up at the groin here, at the left groin. And with about 10 circles. We're gonna come down from our left armpit down to our left groin, doing about 5 strips. So that's 2. 3. 4. And 5. So we've gone down. We're gonna start at the shoulder here, do our inward circles, do about 10 of them. So it's about 10. Then we're gonna start on our left arm, just as we did our right arm. We're gonna use it in strips and do our upward circles about 5 times up each arm. If you have one side that's greater affected than the other, spend more time on that side. That'll be most important. If like you have more swelling in your left arm or more swelling in your left breast, you wanna spend more time in that specific area. I'm just gonna do one more just because I wasn't counting. I was talking. And we're gonna flip our arm and do the back side. Four and 5. That's 5. So after we've done that, we're gonna do our lower arm, just like we did our forearm. And again, same thing. I'm doing 5 strips on this side. And then I'll flip my arm and I'll do 5 on the other side. I'm using my half circles. I'm staying pressed and I'm using the tissue I'm using my hand to move the tissue on my forearm. And let's flip and do the other side, going out from the elbow. Three. 4. And 5. Okay, so we're gonna go from the elbow to the shoulder again. 1, 2, 3, 4, and 5. Flip the arm. 1, 2, 3, 4, and 5. So we can do our inward circles at our shoulder. About 10 of these. And then we're going to push the fluid that we just brought all the way up from the arm down to our groin again. So do about 5 of these. Two, 3, 4, and 5. So after we've pushed everything down from this armpit to the groin, we're going to do our deep breathing again. This is our final step of our massage. And again, just to go over the technique, we're breathing in through our nose, letting our belly expand, and out through our mouth like we're blowing out birthday candles, letting our belly fall. So we'll do 10 deep breaths. And that was 10. So after we've done that, we've completed our self MLD massage for both bilateral affected extremities. Thank you very much for following along and watching this video, and I hope you have a great rest of your day.